My name is Kelvin Sapp. Again, I'm with New York State of Health, which is the official marketplace for the official health plan marketplace for the state of New York. This, of course, is the Affordable Care Act coverage that's provided or available because of the Affordable Care Act law passing several years ago. Before I launch into my actual presentation, the slides, there are a few things that I was asked to address by the host of this event. And one question is, how does what we do impact African Americans? Well, we all know that African American populations tend to be disproportionately uninsured and, of course, impacted by many health conditions as well. So the lack of health insurance contributes to disproportionate access to health care, which often leads to adverse outcomes when care is not sought in a timely manner. So delayed seeking in care also usually results in worse outcomes, worse health outcomes. The other question that I was asked to address is, what are 2 or 3 things that can be done? Well, in New York State of Health, of course, we're here to try to close that gap by helping New Yorkers to access the healthcare that they need by getting the coverage that they need. We have sought to make health coverage a lot more affordable. And today's presentation will be focused on some new benefits, some new things that will help to make healthcare more affordable for New Yorkers. Some new provisions that are available through the American Rescue Plan. That's primarily what I will be addressing. Of course, our work is focused on finding the uninsured New Yorkers all over the state. We happen to know that in the New York City market, there are particular pockets, some particular areas that we really want to focus on. Pardon me, I need to grab a drink of water. There are some particular areas that we need to focus on in order to reach those most likely to be uninsured. And then, of course, we know that the COVID pandemic has further exacerbated the issue. So we have a lot of people who lost work, lost income, and therefore also maybe have lost health insurance coverage. We're doing everything that we can to help those people to gain coverage, and again, so that they can continue to get the care that they need. So one of the things that we're hoping we can accomplish through our partnership with Umoja Events, who hosts the Juneteenth Festival, is to get the word out to your contacts, to your network of folk in the New York City area and beyond, wherever you have contacts. We want to get the information out to people so that they know that coverage is indeed available at much lower cost than prior to the pandemic. And many New Yorkers will be able to obtain free or low cost coverage, and we're here to help. We have certified assisters, navigators and others who are available all over the state, all over New York City and communities near you, who are waiting to help you to get the coverage that you need. So that's how I want to lead off, and I'll be ready to talk about anything more once we're ready with the slides. If anybody has any questions for me starting off, I'm happy to answer those. Or I can continue by providing you just a sort of a brief overview of the New York State of Health marketplace if you are unfamiliar with it. Okay, so I see the slides are up, and we can proceed. I'm not sure. The next slide is a short 15-second video that I'd like to show you if it's possible, but if it does not play, we'll proceed without it. All right, so that video, I'll just introduce it a little bit. We're not able to play it, but it's a video just basically talking about the American Rescue Plan and the new financial assistance that is available. So New York State of Health launched this marketplace in 2013, and I've been with the marketplace since its first enrollment period. And since then, we have over 6 million New Yorkers who have gained coverage through the marketplace. Because of the new American Rescue Plan, we have been able to make coverage even more affordable. So we've always focused on the affordability issue. There are many people who were receiving federal tax credits to help pay for their monthly premiums. And so those who were previously enrolled are now able to get even more coverage. And then the other big news is that our income limits have increased, which means that people at higher incomes who previously did not qualify for financial assistance are now able to get some assistance. So that's really what that little video clip was talking about. That's the big news, that new funding is available to help lower the cost of coverage. We can move on to the next slide. So the American Rescue Plan was signed into law back in March, as you see, and it includes larger tax credit, a larger financial assistance that's available now to New Yorkers to enroll in coverage. You must be enrolled in a New York State of Health plan in order to obtain these savings. And it's available to current enrollees and new enrollees. Again, current enrollees who are already receiving tax credits or who were at an income where they would, now qualify because of the higher income limits. Next slide, please. So let me just give you an example. So if you live in the New York City area and you have an income of $35,000, I know that's not a lot of money. You were already receiving $359 each month in tax credits or financial assistance if you were enrolled in a plan. Well, now you will get $478 per month. So instead of paying $278 per month for your plan, you'd be paying $159 per month. So that's a savings of over $1,400 each year. Next slide. Similar example, just showing an individual in upstate New York, in the Albany area where I am, who makes about $50,000 a year. And again, you can see this person will save over $750 annually due to the American Rescue Plan. Next slide. Okay, and so now I just want to kind of walk you through what you need to do based on kind of where you fall in various categories here. So we'll move on to the next slide. All right, so if you are already enrolled in coverage and you are already receiving a tax credit, New York State of Health has sent you a letter back in early April letting you know what the larger tax credit amount is that you will receive. We have already gone ahead and automatically increased your tax credit amount for you. However, if you desire to make any changes to that, you simply do so by logging into your New York State of Health account or contacting one of our enrollment assisters or calling our customer service center. You see the number here, 855-355-5777. And they can certainly help you if you need assistance. We also have a quick little video tutorial on our website, and you see the link here. It can also walk you through how to make changes. Some of you may be wondering why somebody would want to change how much tax credit they're receiving when we've already given them the maximum. Well, some people prefer to wait and at the end of the year, whatever portion of the tax credit goes unused will be available to them as a tax refund. Some people like to play it safe that way. If they think their income is going up, they're perhaps worried about having to pay back a portion of the tax credits that they receive, so they'll hold out. But really, we've increased the limit. If you want to change it, that's this video will walk you through it, or one of our sisters can help you as well. Next slide. Okay, so if you're already enrolled and your income is above $51,040 per year for an individual, for a family of four, that's $104,800, you may now qualify for tax credit. So you may have been previously told that you did not qualify due to the previous income limits, but now if you're eligible, New York State of Health will send you a letter stating your new tax credit amount. So if you are enrolled already, you were previously not eligible for tax credits, you may be getting a letter letting you know that you are now qualifying for tax credit, and it'll show you the amount. And again, check back at this page, see the link that's provided here, which will give you some instruction on how to apply the new tax credit. Okay, next slide. If you are not currently enrolled, but you started a New York State of Health application in the past, and maybe you were told you were not eligible or that you were eligible for financial assistance, you are now likely eligible for more if you did previously qualify. And if you did not previously qualify, you may qualify now. So again, we just ask you to log back into your account and check to see if there's some new tax credits for you. Next. Okay, so if you are not enrolled, but you started an application in the past, and if you were previously told that you were not eligible for financial assistance, again, as I just said, you may now be eligible. And here's a little example for you. So if you're in Kings County, it's Brooklyn area, making $55,000 a year, before you would not have qualified for any tax credits, but now you would qualify for $230 a month in tax credits. That's money to help you pay your monthly premium. That amounts to $2,800 annually. A silver plan would cost $390 a month after you apply the $230 tax credit. So again, we would ask you to log back into your account and check to see if you're eligible for larger tax credit, and then shop and select a plan. Next slide. If you are not enrolled and have never started an application, now's the time for you to apply to find out what you're eligible for. As I said at the start, most New Yorkers will qualify for low cost or free coverage. Next slide. If you're wondering how to start an application, we suggest you go to our website, which is nystateofhealth.ny.gov, and there you can start an application on our online portal. If you're not so comfortable with that, you can certainly call our customer service center. They can answer any questions you may have, and they can also completely enroll you in a coverage over the phone. And then the next way, which we think most people use, is connecting with one of our local enrollment assistants who work in organizations or agencies all over the state. Again, in a community near you, they can walk you through the application process, and on our website you can find one of those enrollment assisters at the link you see here. Next slide. We want to also announce a special benefit for 2020 New York State of Health enrollees who receive tax credit. So I was just kind of explaining why someone might choose not to use their entire tax credit. And that was because if their income increased, they might be asked to pay a portion of that tax credit back when they file their taxes. Well, what we want to say this year is no one will be qualified. So under the American Rescue Plan for tax year 2020, individuals will not owe a repayment if their actual income was higher than what they estimated it would be when they enrolled in coverage. So there will be no penalty with your taxes for 2020. So that's an important point that we wanted to announce. We don't offer tax advice, so we would ask you to go to an accountant if you need help, or some tax advisor for that, or visit the irs.gov website. Next slide. This is another special benefit that's available under the American Rescue Plan. So New Yorkers who are eligible for unemployment insurance for at least 1 week in 2021. The American Rescue Plan states that you will be able to sign up for a nearly free health plan through New York State of Health for coverage that lasts the entirety of 2021. To be eligible for this plan, you cannot be eligible for other health insurance such as Medicaid, Medicare, or coverage from your employer. So again, there's a link provided here where you can check and find out a little bit more information about how to apply for this if you indeed qualified for or received unemployment insurance for at least 1 month during 2021. Let's advance to the next slide. If you have questions, you can get help again by calling our customer service center. at 855-355-5777 or meeting with one of our local enrollment assisters, and you can find them online on our website at the link that's provided here.